When Rajesh Shatan had his wounds stitched up at a hospital in Johor Bahru, he saved 1,400 Singapore dollars. The drawback, though, was that he couldn't use his MediSave because the operation was done in Malaysia.
Singapore should allow us to use the MediSave because anyway it's our money. Then we can save our money, our MediSave, because if it is in Singapore, we just may use for a few times, the MediSave will finish. If we use in overseas where we found it's cheaper, we can use more. And our rate of money is very big compared to Malaysia.
Every working Singaporean contributes about 6.5% to 9% of his or her income to a compulsory individual medical savings account called MediSave. These savings can be withdrawn to pay the hospital bills of the individual and immediate family members. According to private clinics, they can help patients claim up to 300 Singapore dollars per condition each year. As of now, Singaporeans are not allowed to use a MediSave for overseas treatments. This is to guard against fraudulent claims.
MediSave, at the end of the day, it's still their own money. It is not like a subsidy by the government. You contribute to it every month, and you naturally want to stretch your dollar. And if they can use it in Malaysia, it's basically using their own money to buy a better product for a much lower price than if you have to pay for it in Singapore.
Get Real wrote to the Ministry of Health to find out if there are plans to relax the use of MediSave. A ministry spokesperson told us that it is considering to allow MediSave to be used for hospitalizations and day surgeries in overseas hospitals that have approved working arrangements with a MediSave accredited hospital in Singapore. However, MOH has not indicated when the scheme will begin. It's a waiting game not only for patients, but for the private hospitals in Malaysia as well. For them, relaxing the rules will be beneficial for their business in the long run.
The total dollar value of the procedure in JB may be entirely covered by the MediSave due to the exchange rate. So therefore, the Singaporean may not need to have as much out-of-pocket expense.
Generally speaking, it's not so easy to get MediSave withdrawal. For the institutions, we need to have the correct systems in place, and we have to have some kind of quality benchmarks to be able to reach. So in order for this to be effective overseas, I can see that there are problems to overcome. Certainly, if overseas institution is able to meet the good international standards and be accredited with the international body, then they stand a better chance of applying to have MediSave usage for Singaporeans.
Meanwhile, as patients explore ways of managing their healthcare bills, Dr. Wong cautions that cost should not always be the main priority.
Let their intentions known and basically to their primary care provider, like for example their family physician, so that any kind of follow-up care can be better coordinated. And if they're visiting overseas, what I would recommend is that the facility that they're going to should at least have some kind of international recognized accreditation, such as JCI, which is a Joint Commissions International. And it's sort of like they set a very good benchmark for the quality of care that the hospital provides.
We've come to the end of this season of Get Real, and we'd like to thank you for all your suggestions and your tip-offs. And we certainly hope we've shown you a part of Singapore that you weren't always aware of. But we'll be back next year with a brand new season with more stories that concern you.